Okay, let me make sure I get the math right. Can I give you back $67,000 this year? Well, let's do the math. But what I'm going to tell you, if you do 4 composite restorations per day, and if I can save you 5 minutes per restoration, that's 20 minutes per day. If you work 4 days a week, that's 80 minutes we're giving back to you per week. And if you work 50 weeks per year, that's 4,000 minutes, which works out to be about 67 hours that you could save this year. Now, if your office is producing about $1,000 per hour, 67 hours times 1,000 is $67,000 you could save this year, or make more of this year, however you want to look at it. So let's go figure it out, because I will tell you, it's a lot nicer spending time on the beach than being in the office. Sort of.
I'm Dr. Michael Miyazaki, and that was a fun little clip to take on the beach. And what I have to share with you today will allow you to have more time to do things just like that. So today we're going to be talking about one of my favorite products. It's so easy to use and it saves me so much time. And that product is Seamfree. So how does Seamfree save you time? Well, how many times do you work with composite? Every day. Probably several times a day in your restorative work. And when we use composite and we try to place that composite with our instruments, sometimes it can be very difficult because the composite sticks to our instruments. If the composite sticks to our instruments, then as we lift that instrument up, we may create voids, air bubbles. We may pull it off and away from the preparation, so we could have post-op sensitivity. And it just gets to be very frustrating. It's like trying to get something sticky off your fingers, and it's hard to do. Or maybe you're doing a large composite restoration, like a facial veneer, or maybe it's just like a class 4 type restoration. In this case, we just have a small facial repair we want to create on a tooth model. But this tooth model replicates a lot of the challenges that we have when we place a large, especially a flat surface restoration, where we may have several layers of composite. And when we place those layers of composite, we have a few challenges. One, how do we spread it? How do we get each layer of composite to blend into the other? How do we do this without having any type of layer created in between those layers of composite? So when we polish it all up, it may look great when it's wet, but as we polish it up, we start to see these little voids, these lines, and those white lines just drive us crazy because we try to add a little bit of composite into that area, and it just never looks good. So those have been some of the challenges that I've had. In order to place our composite with less stress, less frustration, I've used alcohol. That alcohol was like my composite weighing resin. The problem with alcohol is it contains a solvent, alcohol. Sometimes I'd use my adhesive, and that seemed to work fairly well. But the problem with adhesives is that they also many times contain a solvent. And it could have fillers, and those fillers will add a layer between my layers of composite. And the adhesive oftentimes contains photoinitiators. And then those photoinitiators get into my composite, and especially with my loop light and my overhead light, it could cause my composite to set faster. Sometimes I use nothing, and as I've shared with you, that just leads to frustration and hair loss. So I don't recommend any of those anymore. You don't need to use alcohol, adhesive, or suffer hair loss any longer. Why? Because we have Seamfree. Seamfree is a methacrylate-based resin material. Basically makes the handling of any composite so much easier because your instruments will not stick to the composite. You'll have less frustration, and you're going to save a lot of time. My assistants know that if I do a direct composite restoration, they need to have the Seamfree ready. If they don't have the Seamfree ready, we all are going to be unhappy that day. The nice thing about Seamfree is it doesn't add any thickness between the layers of composite, but it just helps me glide that composite into my restoration, whether it be posterior or anterior. It has no solvents. It has no foot initiators, so it's not going to affect the set time of my composite. And the fact that it doesn't have any solvents means it's not going to affect the physical properties of my composite. So if I've selected my composites carefully because I like their wear and I like the physical properties, I'm not going to alter that by using this Seamfree composite wetting resin. And I will tell you, just a little bit is all you need to have. So if I'm doing a posterior restoration or if I'm doing an anterior restoration, what my assistant does is puts about a half a drop on the back of my glove, and that's going to do it. That's going to help me get through the whole procedure, and I'm not going to have to use a lot. So you either have a little syringe dispenser or we have these ball dispensers, and you just place a drop or a half a drop. That's all you need. I take my instrument and I just dip it in that little drop, and I'll spread it out because you don't need to have even a visible drop of Seamfree on your instrument. Just a thin layer will help that instrument. And in this case, just showing how we're taking obviously a thick composite, haven't really warmed it or anything like that, just trying to keep it as sticky as it could be. This oftentimes is the most challenging type of restorative material to work with because it is so thick, it is so sticky. And what we're going to do is we're going to place a little bit of Seamfree on the instrument, just a little bit, and then we're going to go back to the material, the composite, and just show you how that instrument doesn't stick to the composite. What we're able to do is we're able to shape that composite. In this case, with an occlusal composite, we can put a lot of the anatomy into that composite, so that when we go to adjust the bite, the occlusion, we'll have very little adjustments to make, very little polishing. If I'm working on an anterior tooth, we can layer our composite down, spread it out. I actually create all my final contours. I create the transitional line angles, create the angulation of my incisal edge. I blend everything into the facial part of that composite, and I cure it. Once it's cured, I may go back and polish it up just a little bit, and that is about it. The Seamfree is not going to add an oxygen inhibited layer to the surface of my composite. And I take my composites really now to the final contour. Whereas in the past, what I would do is I would usually place a little bit of extra composite, especially if I was working on an anterior composite restoration, cure that, and then go back and remove the excess material with discs or burrs. But that was just time consuming. But here you can see, even on a posterior, we can place our anatomy, we can get everything really to its final contour, and our instruments are not sticking. And you can see the composite itself is sticky, but our composites are not sticking. So think about how much time that would save you. If you're doing a posterior composite, how many times do you over contour that posterior composite, cure it, and then go back and do your contouring with your burrs? So in our practices, time is money. If I can take those composite restorations, take them to the final contour, the final shape, and just do a little polishing and not have to do any contouring, that is going to save you minutes. It's going to save you wear and tear on your instruments, but it's going to save you time. So I look at it this way. If I can take my composite restorations to the final contour and not have to go back in there with polishing discs or burrs, contouring discs or burrs even, that's going to save me probably at least 5 minutes per restoration. If I'm doing 4 restorations a day, that starts to add up. If I'm working 4 days a week, 50 weeks a year, and I start to do the math, and let's say that every hour is worth $1,000, at least in production. So if I'm saving time, doing 4 restorations a day, working 4 days a week, 50 weeks a year, that's 4,000 minutes. The 4,000 minutes works out to be about 66.67 hours. And going back to what we're talking about, if each of those hours is worth $1,000, by just using Seamfree, a half a drop, I'm going to save the time whose value is $66,670. To me, that is a very good investment. So if you could save $66,000 by using a little bit of Seamfree, would that not be worth it for you? I will tell you, every time I do a composite restoration, I need to have my Seamfree out or we're not happy at work. So let me show you another example. This is a patient, you can see that has a need for class 5 restorations at the cervical area. Just want to give you the recipe that I use. Typically, if the patient does not have sensitivity there, I don't worry about anesthetic. They like that. What I do is I roughen that cervical area with my air abrasion unit. I then use phosphoric acid as my etchant, my velvet etch. Now, if I did air abrasion, and if for some reason the air abrasion irritated the tissue, sometimes when I put the phosphoric acid etchant onto the class 5 area, my velvet etch, any etchant, it can elicit bleeding of that soft tissue. So if I get bleeding of the soft tissue and I'm working the anterior area, I use my hemostatic agent, my quick stat free, which is aluminum chloride with magnesium and the surfactants that make it very effective. So in the aesthetic area of the mouth, I use my quick stat free to control the bleeding. Now I rinse off my phosphoric acid. I use my Regen Universal Adhesive because it has a bioactivity in it. I apply that for 20 seconds, letting it soak into those dental tubules. I lightly air dry that to evaporate off the solvents, and then I hit it with a vigorous amount of air because now I'm trying to thin that adhesive out. I light cure that. A lot of times when I'm doing these class 5s, I light cure it because if I don't light cure it and I leave the adhesive wet, the composite slips around too much. So what I do is I light cure that with my pink wave curing light because I need those 4 wavelengths to really cure this well. And then I use the appropriate shade of heated paste composite. So I might use my phaser or my benchtop composite warmer. And that way, when I place the composite into that class 5 area, it just spreads really easily because I also on my instrument have my Seamfree composite wetting resin. I get everything to final contour. I don't leave it bulky. I don't leave it in excess. I actually get down to its final contour, and then I cure it with my pink wave curing light. Now at this point, I just polish it up, make it as smooth as it can be, get it to its final contours, check the bite. Why do I check the bite if I've done a class 5? Because it's probably, that class 5 lesion was probably caused by occlusal pressures. So I go in there and I adjust that if needed. So what's it look like? Well, here we have our class 5 lesion. I've cleaned out the old composite with my air abrasion. I don't have any bleeding, but you can see how it's a little dusty. There's some white dust around the preparations. I go ahead and etch that. I place my adhesive, thin it out as we talked about, and I light cure it with my pink wave curing light. Now I place my warmed paste composite into that class 5 area. I wet the instrument with some of my Seamfree, and I gently begin to spread that out. Now you can see that as I spread it out, I can even add more layers if I need to because the Seamfree is not going to interfere by adding any film thickness between those layers. So I put one layer down and looked at it and thought, well, too flat. And so now I place a little bit more composite, and now we're going to kind of get the correct emergence profile. And this is what it looks like before we do any polishing. So you can see that with the Seamfree, I've taken it to its final contour. I light cure this, and now all I have to do is do some final polishing, and we're good to go. So now you can see how Seamfree is going to save you a lot of time, a lot of frustration, and that time is going to add up to money saved. So if you could save just 5 minutes every time you did a case like this, and you did 4 of these types of cases a day, you're going to save $66,000. Spend more time on the beach. So what I want to just emphasize is we can do this very simply. Our patients are going to appreciate the service. They have less drilling on their teeth, less polishing on their teeth. And this patient was kind enough to send a text message after we finished saying, as always, your work is impeccable. Thank you. You know, really, it's just the work that all of us do. I just want to make it easier for you to do the best work you can. So again, we're creating this community of like-minded individuals, and I hope you like some of these tips that we share. And if you do like them, please share these tips with your colleagues and hit subscribe. We want to grow this. And when we see that we have more subscribers, it makes this so much more fun. So I just want to thank you again for watching this program, and I look forward to another one next week. Thank you.